Hello everyone. I'm glad that you could join. It's going to be an awesome evening because you will learn about Bisoma Acupuncture. I'm sure some of you have been already practicing this and some of you have heard of this and you want to know in person what Bisoma Acupuncture is about. And you are asking the right person and you're here, and I hope that you could put up a lot of questions while you are live so I could answer you directly while I am here for you. So again, I'm very excited because now we could be all together instantaneously. You're on the other side of the globe. It's 8:30 p.m. and the other side is 9 a.m. I'm half day behind you, but hey, we're still on the same page here. Okay, so I am David Lee. I'm an acupuncturist, and I am a practitioner of constitutional body typing medicine using food and Asian herbs. So I'm a constitutional medicine practitioner using acupuncture, food, and Asian herbs. What I will be discussing with you, or the class that will be taking place in about a week, that's on the July 17th and 18th. Indian time is 6 p.m. to 8 p.m., 2 hours each, total of 4 hours. You will be learning about Bisoma Acupuncture, and trust me, you will really learn enough to do a very good job. So that's why I'm here. I'm here to promote the upcoming seminar so that you will be encouraged to attend, and not only that, but you will get the information that you want, and you will get the confidence that you want so that you will get the result. Same as me, same as other practitioners who've been doing acupuncture for 20 years or more. They're very good at what they do. They have very good outcome, and you can get the same type of instantaneous outcome as they are. So I said variety of things. I will go back and forth here and there. In the meanwhile, if you have any questions, just throw them in and I'll reply to those also. I will talk about myself and some things that I do, and at the end we will have some dedicated time for question and answer. Alright, what is the purpose of you being here, and what is the purpose of you being an acupuncturist, and why am I speaking with you about Bisoma Acupuncture? It's very simple. So that all of you, each one of you, can master diseases safely and effectively. I'm saying that instantaneously, that you will become a master because you will have that outcome, that result that we as acupuncturists are looking for. And there's a minimal criteria, and Bisoma Acupuncture goes way beyond the minimal criteria. It will be surprising, or it will fundamentally change your practice in a way that you get to treat many diseases effectively, and it will be safe also. And there are other benefits that come along with using Bisoma Acupuncture. It's very accessible and it's reliable. Accessible means that anywhere you're at, whether you're in Africa or Europe or Asia or North America, South America, and whomever you treat, you have an accessible treatment that treats a variety of problems, not just musculoskeletal, but also internal. And just with the needles, they're very portable. You could be in the mountains or the desert or in the tropical forest. You can do acupuncture efficiently, effectively, and get to manage many different types of diseases. And not only that, with this Bisoma Acupuncture, it's very easy to learn and it's very easy to implement. It's easy to learn because after 4 hours of this Bisoma seminar, you will have a knowledge to be able to master many diseases, and it's just by confirmation that you will see that what you learned is actually correct. And all you have to treat is 10, 20 patients, and that will give you enough confidence to know how effective this Bisoma acupuncture is. And in addition, you get to see the result right away. And this acupuncture, the result is quick and it's consistent. It's very important because when you have a very quick relief, like right after the acupuncture or within an hour or at the latest within 24 hours after the acupuncture, people have an improvement, then that gives you a confidence that yes, their improvement is because of the acupuncture. And not only that, when people have an improvement, they continue to improve as you continue to give them treatment. So it gives you that reliability, that security, knowing that going forward they will continue to improve. And so not only this is very effective, but it's very safe, and you get to treat many diseases. It's easy to learn and it's easy to use, and you get the result right away. And having treated enough people, around 10 or 20 people, you're going to realize that you're already at the master stage. And so this acupuncture, Bisoma acupuncture, it applies to both the beginning acupuncturists and also seasoned acupuncturists. Beginning acupuncturist is, well, I just learned how to do this a month ago or 6 months ago, and I don't know how to treat these problems that well, but I have the tool. There you go. Because you have the tool, that you are going to get as good result as those who have had a lot of experience with the patients. And those who already been in practice for numerous years, it could be 10 years, 20 years, or 30 years, you have certain acupuncture technique that's readily available for you to be more effective because of your experience. Well, you don't have to give that up. All you have to do is add Bisoma acupuncture to your favorite acupuncture style, to your favorite acupuncture points, so you don't have to fundamentally change the way you've been practicing. All you have to do is add Bisoma acupuncture to your style, and you will have even better result. So Bisoma applies to everyone, and this is the reason why I'm coming to you, to India, and those who are in other countries at the international level. Alright, so I gotta give you my background. You're probably wondering who I am. I'm South Korean. I came to United States, arrived in Los Angeles in 1982, and I lived in the Los Angeles area since age 10, and I grew up here and I went to college. So I did not know English, but I knew Korean pretty well. In Korea, I lived in at the base of a mountain, and Korea has 5 seasons. That's spring, summer, fall, winter. So winter is a lot of snow, summer is a lot of rain and green, and there's also monsoon season with a lot of rain and very hot. And so that's 5 seasons. I grew up at the base of a mountain. After school, I went to the mountains and played. So I have this association with nature. I appreciate nature quite a bit. I believe that we could discover so much within the nature. We don't have to create as much, or I should say that, yes, we should create, because Western medicine is very good at creating, and we need Western medicine. Natural medicine, which is Ayurveda, Eastern medicine, Unani, those have been around very long time, and they use nature to work with the body to self-heal. So with the chemistry medication, you get to control the disease. But with nature medicine like acupuncture, body type diet, Asian herbs, and other world medicines, they help the body to self-heal. So the body rebounds on its own. And so that's the type of thing that I discover in the nature, how deep and wide it is. And I am in such a privileged situation to continue to discover what is hidden in the nature, so that we could treat our health issues in many, many ways. And Bisoma acupuncture is one of those. You really have to know as an acupuncturist, you really have to know what Bisoma Acupuncture is. And I'm giving you a very, very good deal. So you do want to take advantage of this really low fee that will get you to a master level very quickly. And this might not come around again like this. And I am doing this because you've been following and because you're very interested. So I do want to let this Bisoma Acupuncture technique to be known to many people as possible. And so I grew up here, and I went to school, junior high school, and went off to college. I did psychology, that was my major, and I also did pre-medicine, so I was more of a psychobiology guy as an undergraduate. And then after that, I got master's in traditional Oriental medicine at Emperor's College. That's in Santa Monica. After Emperor's College, I went to American Liberty University, that's in California, for my PhD in Oriental medicine. So I continued to study after my master's program and then into PhD, and I've been practicing since year 2000, so I've been practicing for 20 years full time. I didn't take a break even during this lockdown situation. I continue to open and see the patients continuously, and this has been a very good opportunity to observe and see that even at times like this, that acupuncture is still relevant for people. Good. And so that's my background. I'm Korean. I eat Korean food. I speak Korean. I write Korean. And somebody might know that I was in Chennai, India 1.5 years ago with my daughter, and we really enjoyed the reception there and the convention hosted by Dr. Muthu Kumar in Chennai. He was very nice and very receptive, and I'm glad to have it started to pass the treatment of Bisoma there, and I'm also looking forward to sharing the Tetrasoma in the future after this Bisoma lecture. So yes, it will continue to advance because you just don't stop at Bisoma. You continue. Bisoma is a quick, fast way of getting a good result, and you become a master, and then after that you go into more advanced stuff, because Bisoma is related to constitutional medicine, it's related to Ayurveda, it's related to Unani, it's also related to full constitutional Sasang Korean medicine. It's also related to 4-needle technique using Tetrasoma acupuncture. So I could also say 4-needle technique is same as Ayurveda acupuncture. So Tetrasoma acupuncture is same as Ayurveda acupuncture because the diagnosis for the doshas are the same. Same as the diagnosis for the Korean Sasang 4 constitutions or Tetrasoma. And these words might be new to you. That's okay, because this all centers around the same thing. You're just using different words, same concept. And that will be a world where you get to treat internal diseases, thyroid problems, irritable bowel, Crohn's disease, the liver, fatty liver, and of course you get to treat COVID-19 too. With the Bisoma, yes you can. Yes, you definitely can. I'm saying that you could also use Asian herbs to treat COVID-19 too. And so Bisoma will be an introduction, or it's more of a gateway into rest of the world medicine that we get to integrate and treat, so that the outcome is going to be like right hand with the nature medicine and left hand with the Western medicine, and it will be more realistically achieved in the future, and you are embarking in that path, starting with the Bisoma. Well, actually starting to be an acupuncturist. You don't have to practice Bisoma because there are so many good practices out there, so many different techniques and schools. I'm proposing Bisoma because it is the next point in revolution and point in evolution of Oriental medicine. So Bisoma acupuncture is not a separate discipline. It is based on the ancient thought of yin and yang and ancient theory of the 5 elements: wood, fire, earth, metal, water. So Bisoma Acupuncture, Tetrasoma Acupuncture, it will help you to understand the yin and yang and 5 element concept at its foundation. So it is, Bisoma is not a branch out, it is part of the mainstream. Alright, so what are the benefits of Bisoma? Bisoma, I did tell you the several benefits, but let me tell you more benefits. Bisoma will fundamentally really quickly improve you as a practitioner. It's all about the results. The patients have good results and your credibility goes up. Patient loves you because your result is very good. And that will be a mutual benefit for both the patient and you, and you're not only helping out other people, you're also helping out yourself, and we become a better community because we do that. We're here for the patients, there's so many things that we have to solve in this world. And when we have a more step forward in an area such as in healthcare, we get to treat many things and help many people to recover and have their good quality of living, then we are contributing towards more peace and people having a healthier world. So Bisoma Acupuncture is very measurable. It's measurable again because it's quick and the result is significant. Patients see the result right away and they see the improvement quite a bit. And it's also versatile, meaning that you're only using Bisoma, but you get to treat mental diseases like PTSD, stress, anxiety, depression, and you also get to treat physiological diseases, asthma, irritable bowel, musculoskeletal pain, sprain, strain, the hot flashes, and also physical pain like elderly. They have hard time as they age to be independent, and this Bisoma Acupuncture helps them to be independent on a consistent, regular basis. And so it helps people to have a higher quality of living. So this applies for young people, for old people, for their problems, where they are at, especially old people. And we're having more and more people that need to have more independent living, not being reliant on other people. And yes, just by Bisoma, you will achieve quite a bit for not only select group of people within a population, but pretty much everybody within the whole population. And Bisoma Acupuncture is also repeatable, meaning that you don't have to do a new diagnosis, or you don't have to come up with something new. Bisoma, you could repeat for the same problem or different problems at different times, and that's why Bisoma is so it's so user-friendly and it's so simple that way too. You do not have to do different points in the future. You repeat the same points and the result is good in the future, and it's also good now. And it's also adoptable. Bisoma is adoptable with other acupuncture techniques. Like I said, if you have favorite acupuncture style, you could add this Bisoma to your already existing acupuncture style, so the result will be synergistically good. And you could put acupuncture on the scalp or the abdomen or local in the back. Bisoma Acupuncture goes only in the hand, the 5 element points on the hands and the leg area, and so then you get to have a more comprehensive treatment. Alright, so then let's see if anybody have any question about Bisoma Acupuncture. I'm going to write down here on the comment, we are doing Q&A now. Please ask question while I am live in person. Okay, and then I will also put in links here I'm going to put a link on for the Bisoma book. Okay, you have a question coming in. All right, let me reply that. Okay, so but let me post this first. You got the if you want to get the Bisoma books before the webinar, and here are the links for Amazon India. You could get the book there, or at the regular Amazon.com. You could also get the book. You could get it printed, or you could get it digital. Your question is, what size of needles used in Bisoma Acupuncture? Bisoma Acupuncture size is 0.18 millimeter in diameter by 15 millimeter in length. So that's all you need. You don't need large needles. You could use very small thin needles, and that is good enough. Good question about demonstration. Yes, definitely a demonstration. You will get demonstration of Bisoma Acupuncture next weekend on the 18th and 19th at the seminar, so that you will observe and see the way I do the acupuncture. I'm sure that will be very important. Just by describing is not enough. When you see the way I do acupuncture, it's going to be more straightforward to you, and you're going to go, wow, I could do this. Now I see how the acupuncture is placed in by hand, and so you know the points, you know the theory, and now with the application, you will have a quick and immediate understanding of knowledge of how Bisoma Acupuncture is done in practice. There you go. Yes, Bisoma Acupuncture needles are cosmetic needles, almost cosmetic needles in size. Again, because hands and the feet have a lot of nerve endings, so you don't need big needles. Not only that, it's not the nerve ending or the pain or the sensation. You don't have to feel it, because there are other nerve endings that are not related to pain. And I think acupuncture stimulates also those, so that you have a good response and results. So it's not just the pain receptors that get stimulated, other nerve endings get stimulated. That's why you don't have to feel the pain to have good results. All right, any more questions? Okay, you would like to see the sample demonstration before? Well, it will be, the sample demonstration will be during the class, and this is just 30-minute presentation, so I will tell you. Well, I will show you the full detail on the way I do the acupuncture. So I'm gonna give you that anticipation. You're gonna see it. So I won't show you now, but I'll show you at the class. How many minute sessions? It will be 2 hours on Saturday, and it will be 2 hours on Sunday. Really, that will be enough. So if you need more information because you didn't ask the question or I didn't clearly explain it to you, you will get it. Even after the class, ask me the question, and then I'll reply to you back. Even after the class is over, so that you have a good understanding. In addition, you will get certificates for attending the class. Alright, so you also get the certificates too. Any more questions? Alright, good. So then I will still wait about a minute. I think we have about a minute or two, and then we will go ahead to end this introductory Bisoma session. So question is, how many sittings need to be done? I don't understand what you mean by how many sittings. The Bisoma class will be just 2 hours on Saturday, 18th, 6 p.m. to 8 p.m. Indian time, and also 2 hours on Sunday, 6 p.m. to 8 p.m. Indian time. So that will be a total of 4 hours on the 18th and 19th. Yes, acupuncture, Bisoma Acupuncture. Bisoma Acupuncture is on the horary points, horary transporting points. So if you want to get ready, learn all the 5 element points of hands and feet. Okay, good. Oh, I see. Sitting. How many acupuncture treatment sessions for an illness? Well, we're treating a variety of problems, and they all have different causes, and they all have a different rate of improvement. So there is no standard response for a disease or in general. So I could be more specific on that, reply on that question. How many treatments does it take for patients to see an improvement? It takes between 1 to 4 treatments. So it's about the same response rate as good acupuncture treatments, because with good acupuncture treatments, depending on what the problem is and how intense the problem is, it will take between 1 to 4 treatments on average. As a range, I would think about 90% will definitely see an improvement within those number of visits. Alright, so those are very good questions. Any more questions? Because I'm not going to tell you too much right now, but if you ask me a question, I will reply to your questions. In the meanwhile, while I'm waiting for a question, yes, please do register. We will have a link down below for you to register for the class, and it will be just only $40 United States USD. Okay, that's $40 in United States dollar, and that's very, very cheap for what you're going to get. On my Udemy right now, the price is much higher than that. So take advantage. This will be an important point for you to be a very good practitioner and your patients to be very, very happy with you. Oh, you are very welcome. Yes, after 2 days, two days classes, you can start practicing. It's that easy. Yes, you can start practicing after 2 days of my seminar. Very well. I look forward to seeing you then, and have a good morning. Enjoy your rest of the day, and I will see you everyone in 1 week.